even more, consider the very short dreams we have during non-rapid eye movement sleep, but they didn't serve a purpose. So, without giving you the references, we now have come to the finding that dreams help to store memory. And they store memory in different places in the brain. More important memories are more accessible. And so dreams serve a memory-serving function. Also, dreams download emotion. This is why we have so many unpleasant dreams. We work through the unpleasant dreams and the unpleasant emotions in the dreams, get those out of our system so we can arise bright and fresh in the morning and not be crabby and ornery and bitchy and unpleasant. Because we've done all of that at night in our dreams. This is why it's so important to preserve time for dreams and not shortchange ourselves in terms of sleep, not use a lot of drugs and alcohol with a vivid dreaming, or we will, again, not have those emotions work through. Dreams also have a future planning function. They help us to solve problems. They're very creative. They help us make some plans for future events in our lives. Now, all of this happened over the course of not hundreds of thousands, but a couple of million years, because other animals have rapid eye movement sleep too. Nobody knows what the animals dream about because they haven't told us. But we've got the clue. When rats run mazes, different parts of the brain light up. Now, when rats have rapid eye movements during sleep, the same parts of the brain light up. So they're reversing those mazes. They want to remember the best and quickest way to get to the food, to get to the prize at the end of the maze. And so this is an example of what I mentioned to you about how dreams serve a memory consolidation process. We find it in rats, we find it in humans. It's probably true of monkeys and chimpanzees and cats and other animals too that have this rapid eye movement sleep. So, there's another reason that we can say that dreams have meaning, and that is when we compare dreams. If dreams are just random, we wouldn't find any pattern in dreaming. But people in different cultures have different types of dreams. Children have different types of dreams than adults have. And men have different types of dreams than women have. Again, with many, many exceptions and many, many overlaps. And in the United States, we have two major political parties, Republicans and Democrats. Believe it or not, they dream differently. They have two different types of dreams. And there's a whole book written on the politics of dreaming, where these studies have been consolidated by Kelly Bulkley, one of our past presidents of the International Association for the Study of Dreams. Are any of you members of this group? Keep it in mind, IASD, look at our website. This is a wonderful organization. Sometimes we have our international conferences in Canada, and we have had past presidents from Canada. We just had our international conference in Berkeley, California. Next year it will be in Virginia Beach, Virginia. Hundreds of people come from all over the world to discuss dreams in all of their great variety. So, one of my favorite studies is a study done in Nigeria among 3 different tribes. One tribe had a lot to eat. One tribe was always starving. One tribe was in the middle. They had 3 different types of dreams. The dreams who had a lot to eat had more dreams about food. Why? Because food was a part of their daily life. And you dream about what you do in your daily life. The dream that was starving had very few dreams about food. This is a refutation of Freud's notion that dreams are wish-fulfilling. A few of them are, but no, that's not the major function of dreams. Or the starving people in Nigeria would have had lots of dreams about food. They didn't. And the group in the middle had some dreams about food, some dreams about something else. It was Alfred Adler who was more to the point. Alfred Adler came up with the point, dream life mirrors waking life. And if you read Alfred Adler on dreams, you find that he was much more modern, much more in concert with recent scientific problems than was Freud. Not to put down Freud, he was a great pioneer. It's just that, you know, you have to go where the data are. And Adler, I think, would stand up very well today if he were alive in terms of his points of view on dreams. So, what part of the brain is most active during dreams? Some neuroscientists use the word default mode. The type of mode that our brain is in during waking states emphasizes logical problem solving, a lot of frontal cortex activity, a lot of, for English-speaking people at least, and for right-handed people, a lot of left-handed, left hemisphere activity. Now, people who are left-handed do a little more in the right hemisphere. And people from Japan and China mix up the hemispheres. Why? Because their language uses a lot of images, and imagery is more common in the right hemisphere. Also, they use a lot of nature sounds in their language, and nature sounds are more common in the right hemisphere. There's even a book called The Japanese Brain on how language makes the Japanese brain different than the Western brain. So, you know, the brain is malleable, it's shifting, it's changing. And those changes can often depend upon culture. But whatever the brain is like during the waking state, when you go to sleep, the brain shifts into the default mode. Parts of the brain that are usually quiet and not very active while you're awake become very active while you are asleep. Especially the lower brain, especially a little part of the brain called the pons, the P-O-N-S. And a couple of times during the night, there's a lot of activity in the pons, and that whole area, the reticular activating system, the RAS, and electrochemical impulses shoot up into the cortex. And what happens? They hit the visual motor cortex. They produce images in the visual motor cortex. That's why most of our dreams have movement and have sights in them, because that's what happens in the visual motor cortex. Next, they go to the auditory, so we do have some sound in dreams. Very rarely do they get to the pain, the smell, or the taste. That's further back in the brain. That's why there is so very, very little pain or smell or taste in the brain. It's interesting to know this because somebody might come to an old-fashioned dream interpreter of the psychoanalytic school and say, you know, I dreamed that I had my head chopped off and I didn't feel any pain. Oh, the psychoanalyst says, you're repressing your pain, you're having your head chopped off, the very seat of your being, and it means you're cutting off your reason. The fact that there's no pain is very important. No, that's nonsense. There's no pain because these electrochemical impulses do not reach the pain centers of the brain. So if you look at dreams from a neuroscientific point of view, you learn a lot that you can use in your clinical practice if you're clinicians, and a lot that you can learn simply by working with your own dreams. So, in summary, for the people who just came in, dreams are the result of an evolutionary process, not only with human beings over the last 2 million years, but with animals, and even birds have a little bit of rapid eye movement sleep that go back much further. But here's an interesting thing. Dreams not only occur during rapid eye movement sleep. We're engaging in mental activity all night long. The other mental activity is not as vivid, it doesn't have as many stories, it's not as exciting, but it sort of keeps things moving. It keeps the wheels greased. It keeps the brain tonus active. And so they serve a purpose as well. And after having said all of that, don't think we know all the answers, because there are still many unsolved questions about dreams and how the brain produces dreams. And there are still many competing theories, and in my opinion, nobody yet has the last word. So there's a whole undiscovered realm in front of us, but at least I've given you a little summary. I should mention the hippocampus and the amygdala, because those are in the emotional area of the brain. And emotion is very important in dreams, because when these kinesthetic movement and visual images are produced, they might be produced more or less randomly, but they start to link on to emotion. And there's like a chain reaction, a neural network. And this is how the emotions come in, and this is how dreams make a story. Dreams make wonderful stories, and those stories are exactly alike. Dreams are very, very creative, and many novels, many symphonies, many inventions have come from nighttime dreaming, because a dream is able to combine things in many unusual different ways. Okay, so folks, that is the introduction to the science and the psychology of dreams. And now we're going to put that to use by actually doing some work with dreams, unless we have one or two burning questions. Does anybody have something really important that they would like to ask before we move on? Yes?
I'm just curious about dreams and sleepwalking.
About what?
Sleepwalking.
Yeah, sleepwalking, you don't dream during sleepwalking. That's a sleep disorder. It can be very dangerous. If a friend of yours is sleepwalking, you gently guide them back into bed without waking them up. And you don't have rapid eye sleep during sleepwalking. It's like a night terror. That's another sleep disorder. You don't have dreams during night terrors. You just wake up in the middle of the night, frightened and afraid. And again, the old-fashioned psychoanalysts would have a kid come, and the parents would pay the analyst a lot of money and say, oh, my kid wakes up in the middle of the night. Oh, the kid needs psychotherapy. So after a year of psychotherapy, the kid is no longer having night terrors. No, the kid has outgrown the night terrors. These are developmental blips. And the psychoanalyst has gotten a lot of money. The kid feels fine. The parent feels fine. Everybody's happy. But same thing with sleepwalking. Those are sleep disturbances. Some of them are transient, not very important. Some of them are chronic. Those are important. But in neither of them do you have significant numbers of dreams. Okay? Any other urgent burning questions? Mark, you have something.
Would you just say a word or two about dreams and hallucinations?
About?
Dreams and hallucinations.
Yes. Yes. A hallucination occurs while we're wide awake. And a hallucination, briefly put, is a sensory impression, usually visual, but it can be smell, it can be taste, it can be sound, of something that other people don't see, sense, or hear. Now that doesn't mean it's not real. I'm not going to make that value judgment. It's just that it is not consensual. So, many people say that dreams are hallucinations. Well, there is a hallucinatory element in dreams. But dreams are really in a different kettle of fish than hallucinations, because dreams have their own logic. They have their own rules. They have their own sense of time and space. And, of course, what you're dreaming about is not corresponding to what's happening in the consensual world. I hate to use the word real world because the word reality is too prejudicial for me. But the consensual world means that most people don't experience the same thing or do experience the same thing. You go to sleep, you have a dream, And some people would call those dreams hallucination. If you were awake, they would be hallucinations, yes. While you're asleep, I don't think it's fair to call them hallucinations. You simply call them dream images, or dream metaphors, or dream content. Call them something else. Do honor to the dream. Remember, the brain is different when it's awake than when it's asleep. The brain shifts into another mode. So why use terms from a wakefulness paradigm and superimpose them on a sleeping paradigm? Mixing apples and oranges doesn't make sense. So, good question, and that gets to something very, very basic about dreams. Yes, Bob?
What about dreams and what happens when you go under hypnosis?
The what?
Hypnosis, when you go under hypnosis?
Yes, you can hypnotize. This is a very common ploy of hypnosis. It's called a hypnotic dream. It should actually be called a hypnotic daydream, because in hypnosis, if a person goes deeply enough, a person can come up with all sorts of wonderful stories that can be used for psychotherapy. It's a very effective type of psychotherapy. And again, I wouldn't call those hallucinations because they're not spontaneous. They're guided by the psychological or psychiatric hypnotist. And as I say, they can be very, very useful in psychotherapy. But, you know, the brain is just filled with capacity for images and metaphors that store and condense and combine all of this material. This is where Freud was absolutely right when he used the word over-determination and condensation. A lot of material can be pulled together into a dream image, into a dream scenario. And that's hopefully what happens when hypnotic dreams are elicited. Okay?
And what about when people go into deep meditation? They see a lot of...
Oh yes, sometimes people have the same thing in deep meditation. Usually not. Usually in meditation, you don't have much content. But again, there's different types of meditation. There's Tantra meditation, where you come into contact with all sorts of deities and spirits, and this is what you're aiming for. But again, these are internal images. These are non-consensual. These are private images. This is a world of private experience that people like Carl Jung would say reflect an archetypal world, a collective unconscious. Well, that might all very well be so, but still, it's not a public type of image. It's a private type of image. Okay? Yes, finally we go over here, Dean Bob.
I'm a patient man. Mark's question suggested another to me, and that is, in the experience of bereavement, evidence points to about 70% of people, after having lost a significant attachment figure, having experiences of the presence of the loved one. And often this occurs in that kind of hypnagogic state between sleeping and waking, in which they will have imagery or maybe a bodily felt sense of the presence of the other. And this often is reported to have a dreamlike quality.
Yes.
So I'm curious about what you might understand to be the mechanism of that, or what such experiences could mean within a dream frame.
Sure. Bob, of course, is one of our international authorities on grief counseling, and I'm sure this comes up many times in his work. But when somebody loses a significant other, it takes a while to readjust to that loss, and it's very common for people to dream about the significant other, but it's also very common for them to have images of the significant other just as they're going to sleep, which we call the hypnagogic state, or waking up, which we call the hypnopompic state. Those are twilight states of consciousness. And this is the ideal time to have those images, because it brings up what they might have been repressing during the day because it's just too painful, but also it brings up the image of these people that can be a healing modality for them because it's done in a dreamlike state. Some of you have heard of Raymond Moody. He has actually invented a device, a mirror, and people will go into this room while they're grieving, and after a few minutes, many of them see the image of the lost loved one. in the room. And maybe it is the actual person from the spirit world, maybe it isn't. That's neither here nor there in terms of our discussion. But the point is that people who go into this room and have the image do recover from the grief more quickly. It serves a healing quality. And I would say that the hypnagogic and hypnopompic images serve a healing quality for the grief-stricken person. These have been wonderful questions, and we'll have more questions in the future. But now we're going to give you folks some experiences. And the first one is something that you can all do by yourself. So you don't have to be shy, because nobody will have to know about this. If people come in late, we'll just pick them up. Yes, come on in, we have plenty of chairs. There's a chair right down in front, there's a chair right in back, wherever. Now, is there anybody in the room who does not have a dream to work with, who has never remembered a dream in their life? Okay, you all have a dream to work with. Fine. Or a daydream. Or make up a dream, because that comes from the imagination too. Now, I'm going to show you how dreams have meaning. I'm going to show you how emotion is so important in a dream. I'm also going to show you how dreams can be useful to you in a practical way. Now, that's a tall order. And I'm having to go through it a little more quickly than I would like to. But once you know the steps, you can go through it yourself. Okay. What I'm going to suggest you do is to just close your eyes. Some of you have come from other parts of the country or the world, as I have, and I'm half asleep, so this will not be hard for you to close your eyes and imagine something. Close your eyes and just review your dream. Dreams are like stories. They usually have a beginning, a middle, and an end. Not always, but they usually have a starting point and an ending point. Review your dream. Now, in reviewing your dream, what is the most emotional part of that dream? Remember we talked about how important emotion is in dreams? Well, this is going to be an example of that. What part of the dream had the most affect in it, the most emotion, the most feeling in it? Maybe several parts of the dream do. Well, just pick one. Just pick one. Now, imagine that the emotion from the dream is with you right now in this room, in this body. Imagine that you are feeling that emotion. What part of your body is especially sensitive to that particular feeling? And how would you describe the feeling? Sadness, joy, mirth, merriment, happiness, despair, grief. How would you describe that emotion? Okay, now go back to the bodily feeling. What is that feeling like, and what part of your body is most moved by that feeling? And now take that feeling back to the time. Where and when did you have that feeling before? For you to have had the feeling in the dream, and because dream life mirrors waking life, you must have had that feeling or something like it before, as a child, as an adolescent, as an adult. So go back and find some waking life experience where you had that feeling before. It might be something you haven't even thought of for years. It might be something that you've forgotten. If it's too painful, just skip it. Go on to a different experience. But come up with a waking life experience that had some element of that feeling in it. Maybe not exactly the same as is in the dream, but something similar to what was in the dream. Now, I know it's difficult to go back over the years and resuscitate a feeling that maybe you've forgotten about. But give it a try and we'll see how many of you can come up with something. Is there anybody that cannot find a match from their early life experience and the emotion of the dream? Okay, a few people. Let me tell you folks what to do. If the emotion in your dream was pleasant, go back to a pleasant experience from your younger days. If the emotion in your dream was unpleasant, go back to an unpleasant experience in your younger days. If the dream emotion was mixed, pleasant and unpleasant, go back to an experience where you had some mixed feelings. Okay? So now you all have an earlier experience to work with, right? Anybody who does not have an earlier experience to work with? Good. Now is the time to fill in the details of that early experience. When did that take place? More or less. You don't have to come up with a month or even the year, but more or less when did that take place? Where did it take place? What did you look like when this was happening? How much did you weigh? How did you do your hair? What might you have been wearing? How tall? How short were you? What did you look like? And what happened? What actually took place? Okay, now some of you are going to be happier doing the rest of the exercise with your eyes open. Some of you with your eyes closed, doesn't matter. Some of you might even want to take notes. But here is the critical question. What came out of that experience for you? How did that experience affect your life in a major way or in a minor way? That experience is like there was emotion involved. Emotion affects our life. So what emotional residue came out of that experience? And how would you put that emotional experience into words such as, I can't do anything right, or my parents really love me, or I enjoy going to movies with my friends, or I never am going to get ahead in the world, or the people around me are just plain stupid, or I feel very content when I'm praying. Okay, those are all statements that might have come out of that emotional experience, major or minor. One sentence. There are sentences that I call personal myths, personal stories, one sentence stories. You can call them beliefs, you can call them schema, you can call them worldviews, you can call them scripts. But these are the stories that run our lives, whether we like them to or not. Okay, now ask yourself if that sentence or that statement is something that still is affecting your life. Maybe the statement was, I'm surrounded by stupid people. You think, well, I believed that when a kid, but I don't believe that anymore. That was naive, that was immature, that's from the past. Okay, you've outgrown that, that no longer affects you. But there might be something that does affect you. No matter how hard I try, I can never get ahead. That still might be with you for decades and decades and decades. It might be true, it might be false. We're not concerned with truth or falsity right now. We're only talking about the effect that these statements have upon your life. Okay, now, take that sentence and take that experience back to the dream. Does it help to explain the dream to you at all? Maybe the dream is a metaphor or a symbol for that statement, for that life experience. See if you can make a connection between the dream and the life experience of the statement. In philosophy and psychology, we talk about a hermeneutic circle, a circle of meaning. You have just gone on a hermeneutic circle. For some of you, the circle is very logical. For some of you, it's a little bumpy. For some of you, it's incomplete. But I would like a volunteer to come up to the front of the room and run through the circle with me. Who would like to volunteer what they've just done? Wonderful, thank you. Now, you're going to have to pull up your own chair because it's going to be more comfortable if you sit right across from me. Am I speaking loudly enough for you folks to hear? Thank you. So you speak loudly enough too, Elizabeth, okay? Okay? Now we're having to go through this very quickly, Elizabeth, because we're limited in terms of time. But can you briefly tell us your dream?
Well, I have it many times.
It's a repetitive dream.
And
That's the best type to use for this type of exercise, by the way.
yeah.
Okay?
And it's constantly, I'm placed in a familiar setting, but I'm left with a baby. The baby has appeared from nowhere, and no one else is around, and I'm responsible for that baby. And I think, what do? I don't have necessary things to look after a baby. I'm just given this baby, and I'm by myself.
Okay. What feeling came out of that for you?
Anxiety.
Anxiety. When you went back to the past, what experience did you have of anxiety?
It was when my first baby was born, and I went to the health clinic, and she said to me, he's not putting on enough weight. You're killing this child.
And so, did you put on more weight?
The child, I put him on extra food. I was breastfeeding at the time, and I was quite happy and content when he was born. But after about a month, I went to the clinic system, And she said to me, he hasn't put on enough weight. That's what I would expect. Yeah.
Okay, so what came out of this for you? What personal myth, what worldview came out of this episode?
Well, actually, she hadn't ever had a child. So I thought, do you really know what it's like to be a mother and to be saying this to a new mother? It's not fair to be doing this to someone. I think as a clinic sister, there are certain things you can say to a new mother, but do it with compassion and understanding, as well as the science of, this is the chart, this is how the child should be progressing, but take more things into consideration.
Okay. Take that back to the dream. Can you make the connection between that and
Definitely. Absolutely.
Yes, what's the connection?
That here I am again, totally alone. She didn't really give me much answer. She wasn't compassionate at all. And here I am in a dream, and I've just landed this baby with no resources to go on.
Okay. Have you had other children?
Yeah,
How they turned out?
they're both wonderful.
Okay. So, what can you do with this experience? What does this experience teach you?
To trust my own capabilities and to look at the reality in life that I do have two wonderful sons that are extremely capable and healthy, that I'm extremely proud of.
Why do you think that this dream is repetitive? Why do you have it several times?
Maybe I still have that little question in my mind, have I done a good enough job?
Yeah.
Yeah, but in reality, in a way, they couldn't be better.
That's right, I agree.
Yeah.
So let's look at this positively. If you do have the dream again, look at it as a reminder that you're doing very well, and trusting your own judgment is more often than not superior to trusting the judgment of somebody who doesn't have first-hand experience in terms of what she's talking about.
Yeah. Well, I think I'm sort of getting to the stage of possibly grandparenthood. So maybe that is why it's coming more. That hasn't, neither of my sons have married yet, but they have long-time girlfriends, and I'm hoping. So there's that. I want a grandchild. So there's all that connection.
Okay, so that would be very logical for that type of dream to pop up then, sure.
Constantly.
Yeah. And like I say, take a positive spin on it and see the positive stuff that can come out of that dream again and again. Okay, thank you very much, Elizabeth. I shudder to think how many obese children there are in Canada as a result of advice that this expert has been given. As you know, 2 out of 3 children in America are obese. It's a national scandal. And much of it comes from poor advice saying babies should be fat. Many pediatricians say, yes, your baby has to put on more weight. And the baby never takes it off. And now we're paying the price for it in terms of obese children. So thank heavens that you went back to your own judgment and trusted your own judgment. Okay, so now we've seen the hermeneutic circle, and this is something you can do yourself. And it's a technique that I often use in the morning. I remember when I'm doing my morning jogging or exercising, I often focus on the emotion of the dream, go back to, I give the emotion a name just for shorthand purposes, go back to an earlier life experience and find out where I had that emotion before, what belief came out of that? How did that early life experience affect me? And then, almost always, there's a match to the dream, and I can learn something about the dream. You see, this dream interpretation technique doesn't take every single item in the dream and interpret or analyze it. It takes the dream as a whole. This is not the only way to work with dreams, but it's a very efficient way of working with dreams yourself. Okay, any questions on this particular procedure? Good, because we'll move on to something else. Remember, no technique is going to work perfectly with all dreams. But this is a technique that works very, very well with most dreams. So now we have some volunteers, and I haven't even had a chance to read their dreams yet. And I'm going to quickly choose one of them for the next go-around. Okay, these are great dreams. Really just go for them. Now, here's another recurring dream. Who had the dream about being in a pleasant situation? Oh, good heavens, right in front. So, you stay right where you are, and I'm going to come down and talk with you, okay? If I can maneuver this chair a little bit. And what's your name?
Irene.
Angie?
Irene.
I'm hard of hearing, so
Sorry.
let me take a look. Irina?
Yes.
Irina, that's a wonderful, wonderful name. I have a sister-in-law called Irina. She's German. But I have a friend from Russia called Irina.
That's the one.
Okay. So, Irina, we're going to do some role playing here. And you can pull up your chair just a little closer. I'm going to demonstrate the Clara Hill technique of working with dreams. Clara Hill, in my opinion, is the best dream researcher for clinicians to know about, because she has run a number of experiments at her laboratory. She's written a wonderful book, Use of Dreams in Counseling and Psychotherapy, published by the American Psychological Association. A wonderful book. And if you're a clinician, if you want to work with dreams, you should read that. Well, what she has found out is that psychotherapists who work with dreams have clients who move through psychotherapy faster, they get more out of it, and they have greater satisfaction. And so she's trying to bring dreams back into psychotherapy. Frankly, very few psychotherapists use dreams. But she has a very, very quick and efficient three-stage way of working with dreams that doesn't even fill up the whole therapeutic hour. So, we're just going to do some role playing, and I'm going to make up a scenario for you, and you just go along with it and just talk about the dream. Well, you know, we've been seeing each other now for a couple of times, and we've been working with dreams, and today you brought in a recurrent dream. How often does this dream recur?
Once a week.
Okay? Okay, I'd like, in your own words, for you just to tell me the dream, and of course, speak loudly enough so that the audience can hear it. Go ahead.
Okay. I'm generally in a pleasant situation, either in a pleasant environment or in the presence of a pleasant person. Let's use a pleasant environment. Let's say I'm in Venice, because that's where I've gone before and I loved it. And I am sightseeing and I see a gelato stand. And I love gelato. And I go and I carefully pick out the flavors and I get this gelato. And after I get this gelato, the dream ends. So whatever the situation is, I get awfully close. I can touch it, I can see it, and then and I never get to live it out. You know, or a romantic encounter. You know, PG-rated romantic. You know, you're in the presence of someone, you like the person, it's, you know, you're in a state of serenity and peace and bliss, and you're right there, and right when the dream is supposed to take on, it ends abruptly. And I have to go to work every time.
You know, you've got a great deal of self-insight and self-knowledge. What's your immediate take on the dream and what this dream might be telling you? Or what it might be reflecting?
Perhaps it reflects my nature of, I don't know, being too controlling or not taking risks or not giving myself what I want. Except in real life, I never experienced this feeling, oh my God, I want this, and I can't have it. So perhaps it's a subconscious thing where, you know, but in the dream, I'm very aware of what I want. And I want it very much, and I'm in that feeling, and I can't have it. But in real life, I rarely experience wanting something so bad and not being able to have it. It's rather maybe not wanting it or not finding what I want. So it's kind of...
What's the example in your waking life of something that you might really want a lot and that you don't think you're getting?
Well, the ice cream I think I can get. The ice cream I think I can get, I don't know, maybe a blissful romantic encounter or something like that.
Well, you know, sometimes dreams speak to us in terms of symbols, and ice cream is a symbol for many, many people. What might ice cream represent to you? If it were my dream, I would think of ice cream as representing milk, mother's milk, nurturance. And I'd think maybe something happened to me as a child, maybe something is still happening, where I need a little more nurturance, a little more affection, a little more attention than I'm really getting. And the fact that it's ice cream instead of milk is important because as an adult, I'm not going to crave milk, but as an adult, I still can crave ice cream. So it's bringing me up to date there, but also being ice cream indicates that the nurturance isn't going to really be the nice warm nurturance that maybe I deserve. It's like icy and frosty. So even if I got what I wanted, it wouldn't really fill the bill. I've got to examine my real needs and my real wants and see if there's something more appropriate that I should be directed toward. What do you think of that?
It makes perfect sense.
Makes sense? Okay. So if that makes perfect sense to you, could you go back over the dream and sort of retell the dream in terms of how it might apply to your daily life today and what we were talking about? If somebody were to say to you, okay, now what do you think the dream means to you, what would you tell them?
Well, I mean, perhaps re-examining what it is that I really want. Perhaps what I think I really want may not be appropriate, or the kind of, like, perhaps it was a day I captured in my mind as a really
What does it
wonderful
mean
experience.
for you? What does it mean for you?
Just this magical experience of, oh my God, this is...
In your program, by the way, she has the dreamer produce the dream, and then the dreamer and the therapist work together to clarify the dream. And then this leads into an interpretation that the dreamer puts in her own words, and then this leads into behavior. This is the action-oriented aspect of the procedure. So, there are actually 3 steps in Clara Hill's procedure, all outlined in your program, by the way, and you can see how neatly one leads into the other. And she can do this in a fairly brief amount of time, or she can devote the whole session to it. But the reason that she likes to do it in a fairly brief amount of time is to get back at the therapist who are saying, oh, I don't have time to deal with dreams. Dreams are so complicated, it would take the whole therapeutic hour, and we've got more important things to deal with than their question. I should have paused for questions. I didn't think of it, but let's have this question over here.
Well, it's a pretty simple one. I don't know where those 3 steps are.
Let me take a look.
I can't find them.
Okay?
Has anybody seen it?
Look on page Clara Hill. He is a psychotherapist. He died recently, unfortunately. Both Clara Hill and Montague Ullman, very close friends of mine, learned a lot from both of them, and I always enjoy discussing their work. Montague Ullman has a way of working with dreams that's a group procedure. I've used this with 3 people, I've used it with 300 people. And I'm going to teach it to you so that you can use it yourself. Because it is so designed that if somebody is not very sophisticated about dreams, at least they can't do anybody any harm. Because nobody is pushing an interpretation on somebody else. The nice thing about a group procedure is that things come out that 2 people often overlook, like the gelato. I never would have thought of that, but that gelato was a very nice interpretation that came out from members of our group. So, for Montague Ullman's procedure, we're going to use this dream. My dreams often involve someone chasing me. Whose dream is this? Oh, good heavens, all 3 of our demonstrations have been right down in the front. That's very serendipitous. All right, can you read this loudly enough so everybody can hear?
Okay. My dreams often involve someone chasing me or someone chasing someone who is me but not me. So it's not always really me that's being chased, although it's from my perspective. In this dream, someone, because it didn't really feel totally like me, was running from, I call them villains, who were boiling people they caught to remove their skin, I guess much like you boil a tomato or something, or peaches. And then they were using the skin in some sort of cosmetic type procedure to replace the skin of older people who could afford this new skin with the skin of the boiled young people that were using that. And I never got caught, so I wrote I got away, but I wouldn't say I got away because I woke up. So I never was caught. And I should end there and not put any interpretation upon it.
That's right.
Okay.
Now, I'm going to give you some warning in advance. Seeing this as a workshop, I want everybody to get involved in as many ways as possible. All of you got involved in the demonstration of the emotional connection. Each of you did that by yourself. We're going to divide our room into maybe 4 groups, and we're going to have a leader of all 4 groups. We're going to have a dreamer of all 4 groups. So pay very close attention to what I'm doing, because one of you will be doing the same thing that I will be doing with
Marilyn.
Okay. And this will give you a chance to rehearse it. Okay, the first step is for the dreamer to read the dream, and that's it. We don't want to know when she had the dream. We don't want to know anything about her at this point. We're focusing on the dream itself. And the person who is the group leader has to be very careful to protect the parameters of the dream. And we don't even know if this is a dream she had last night or 10 years ago. We don't know any of that. But the second step is to clarify the dream. Is there any question about the dream content that is not too clear? For example, is there color in your dream?
Yes.
Okay, what are the colors in your dream?
Red. Boiled skin is pretty red, so I don't know how I'm running away and also seeing the results of their technique of boiling to get the skin off that I was.
And you say that the dreams often involve someone chasing you.
Yes.
So this is a dream that you have more than once.
Not the boiling skin part.
Pardon me?
Not the boiling skin part. I often am being chased, or someone is being chased in my dream, but the boiling skin part is new.
Okay. You describe these people as villains. What do you mean by villains?
Well, that was not a word that I had until today, but I was trying to describe the people chasing me are bad for what they're doing. They shouldn't be chasing innocent people to get their skin.
And how are they using the skin of their cosmetic surgery?
So they're somehow taking this skin that's been removed from one person and replacing the skin on another person.
And so they boil these young people to get their skin?
Yeah, which doesn't make any sense, I know.
No, you can't say that.
Okay, sorry.
In the dream, it makes perfect
It
sense.
makes perfect sense.
Don't superimpose our logic upon the dream logic.
Right.
You'll be fine.
Okay.
Okay, this will be a very interesting dream for us to work with. Do you have any other questions about the content of the dream?
The chasing. She herself says it's not clear who's chasing whom.
Well, no, I'm being chased, but I'm not necessarily me.
Okay, that's the one.
That's
That's
the weird.
part
I'm not doing the
that's-
chasing, ever.
Right.
I'm doing the running.
Okay.
But the person doing the running isn't necessarily me
I think that's
exactly.
really important right there.
Are you watching yourself being chased?
No, I'm definitely
You know
in
for
the
sure.
perspective of the person being chased. It's me being chased, but it's hard to say because it's not necessarily me. I'm just the main protagonist in the dream.
It's
But
like you just associate.
No, I'm very much in that role of the person being chased. But I'm just saying that the person being chased might have been a young person, because otherwise, well, that's me putting logic on again, but why would they want my skin? In this dream, I was being chased, they wanted my skin.
Where are you? Where is your position?
In the person being chased.
In the person.
Yes, I am the person being chased. I'm running, I am sweaty, I am
Okay, now,
terrorized.
as you know, Mark Schulman and I are both at Saybrook University, which we have many Canadian students. And any of you who want to find out about our graduate programs can talk to Mark. I believe long since gone, but Mark would be happy to tell you about them. Twice a year, we have group meetings. Other than that, it's all an online tutoring. But twice a year, we have group meetings in San Francisco, and every morning at 7:30, people get their food for their breakfast, and the dreamers of the group come at a table, and we do this whole procedure in 1 hour. And the first step is for the dreamer to pass out copies of the dream, so we all have it, which we can't do today. And then we go through the other steps of the dream. Now, because we can't pass out copies of your dream, I'm going to have you read the dream once more. And as you read the dream, I want the rest of you to think, what would that mean if it were my dream? Okay? Okay, go ahead. Read it once more, and people will start to